Hold it about right there.
Okay.
You hear it? You'll hear it. Yeah. Okay.
Sounds good.
Could you close one of the doors? Yeah, that's great. Yeah, just have Gail. Welcome. Welcome to Beth Chaim congregation for a very important emergency mental health town hall event. This evening, we focus on legislation sponsored by our assembly person, Rebecca Bauer-Kahn, who we are so honored to have here with us tonight. This legislation, AB 988, the Miles Hall Lifeline and Suicide Prevention Act, is a powerful response to the call for meaningful police and racial justice reform. We're also very honored to have Miles Hall's mother, Ton, here with us tonight as well. Welcome, Ton. We're grateful to be co-sponsoring with Assembly Person Rebecca Bauer-Kahn and the Contra Costa Interfaith Council. So, a few words of introduction. Assembly member Rebecca Bauer-Kahn was elected to serve the 16th Assembly District in 2018. Rebecca is an accomplished attorney, environmental advocate, law professor, and mother. A Bay Area native, she was as dedicated to her career to working for our community, protecting civil rights, and is a leading advocate for social justice. Rebecca is the granddaughter of refugees who came to the United States to escape the Holocaust. Their experience has shaped Rebecca's perspective, inspiring her to help others in our own community, including coordinating the legal services effort at SFO to assist refugees and immigrants impacted by the Trump administration's travel ban. For the last several years, Rebecca has taught appellate law and legal research and writing at Santa Clara University and Golden Gate University. Rebecca and her husband Darren live in Orinda with their 3 young children. Without any further ado, Assembly Person Rebecca Bauer-Kahn.
Thank you so much, Rabbi Goldblatt, for having us here, for putting this together. It's really the bill that I carry in my heart, and I know I speak for Ton as well in saying that, and so it's an honor to be with all of you here today who are here in person, but also those of you that are joining us virtually for our first in-person event in probably a year and a half. And so thank you all for coming out and being here. I want to give a special welcome to Gail Israel, who is Supervisor Anderson's Chief of Staff, who's joining us here. Contra Costa County is one of our sponsors of this bill and has been an incredible partner in moving this effort forward, but also on the ground work ahead of this effort to really make sure that we have mental health crisis response that is meaningful in response to people where they're at. So a huge shout out to Supervisor Anderson and her entire team on that. I want to acknowledge all of the groups that have been a partner to us in this, NAMI Contra Costa, all of the cities that have come together to support this bill, and of course, the Miles Hall Foundation. This bill came out of a conversation that the 2 of us had. The first time I got to really sit down and hear Ton talk about her son and his life, the incredible man he was, and what happened to him here in our very own community. And the 2-year anniversary of his death was just last week. And I was able to move AB 988 out of the Assembly with a 70-0 vote on the anniversary of his death. And I'm going to get teary, and I know she's going to get teary at some point, but it is, being in a synagogue, one of the things we do is remember people by saying their name. And to do that with Ton on the assembly floor has been an incredible, incredible honor. And, I will talk a little bit about the bill later, but I want Ton to really start. And I want to first acknowledge her incredible strength and bravery. As you heard, I'm a mother of 3, and this is every mother's worst nightmare. And she has taken what none of us can ever imagine happening, losing her baby, and turned it into strength that is so incredible, and I can't imagine many people in the world having. But she has channeled all of that into making the world safer for other people's children. And that is so inspiring. So when I spoke to her for the first time, and she really told me what she wanted and the legacy she wanted Miles to have, there was no question that I wanted to be her partner in that. So we had this call, and then I think it was about a month later, we said, you need to come back on a call, and we had a draft legislation, and I think Ton was very shocked that we had moved forward with this vision. But that's the work that we do, and the work that you all have elected me to do, the honor that I have to serve each and every one of you every day, including Ton as my constituent, is to move California forward in ways that will save lives, that will make Californians' lives better. And this bill, if it's the only thing I do in the legislature, it will be such an honor to have done this in Miles' memory. I'm going to do a lot more than this, but this is a really important effort. And so I want to turn it over to Ton to speak and share her story with you, or whatever it is she wants to share.
Yeah, hi everybody. That was a wonderful introduction. Unfortunately, it's not a wonderful introduction because we're here, I'm here, and my son, Miles, was shot and killed by the police on June 2nd, like Rebecca was saying. And it's just, I think people don't understand it. It's why I really want to make sure our story is told, because people don't understand how broken the mental health system is. And it's so broken that you have to turn to police and criminalize your children when they're not criminals. And it's so much has to change. My son Miles, as Rebecca explained, 23 years old, vibrant, bright, amazing, sweet. He wasn't a criminal. So when you think of someone being shot and killed by the police, you know, you see it on the news all the time. We see it. And when it happens to your own family and your own community, it's devastating, obviously, to lose a child. And to lose a child when you're going to the people you're supposed to protect and serve and provide service that is going to make sure that your loved one's safe. And in California, you have to be a danger to yourself, danger to others, or gravely ill to get help. So Miles never fit that criteria. He didn't understand he was even sick. So using the police when they're not trained to do this work, they're not social workers. They have 10 hours, maybe 8 hours of training that they get in the academy to provide for mental health services or education. So when I spoke to Rebecca, I mean, we never thought we'd be here in 2 years, right? So we never thought that this is possible in 2 years. I thought maybe in 10, maybe in 5. But, you know, that shows what a remarkable leader you are, and that you do listen to your constituents and you want to make change. So I just want to say thank you for that, because I never thought that my son would be shot and killed. But I never also thought that we'll have a legislator who would listen to us so early on and do the work and do it and and not have to call her like every 5 minutes. She was already like, let's do this. She already had it drafted. It was literally shocking. So I just want to say, now there's so many great things that are happening in Miles' name and legacy. And one of them is that there's a 24/7 non-police response that's happening in the county. And now it's actually been named after Miles. So it's called the Miles Hall Community Crisis Hub. So that's in partnership, right, with Rebecca. So the work that we were doing in the county, trying to get a non-police response, and then Rebecca saying, this was legislation that needs to change that was now to the federal government. That was instead of calling 911, you called 988. So it all fit together. And I really do believe that is Miles in heaven orchestrating a lot of this. So I just, I just want to say thank you. I mean, when I hear you talk, you make me cry, and I don't like to cry, but I'm going to hold it together. But yeah, we need to have safe alternatives for our loved ones. This could happen anywhere. We lived in Walnut Creek, college educated, married my husband when we were in college, 2 kids, white picket fence, nice car. It doesn't matter, right? So the racial equity part is super important too, right? We need trained mental health professionals to answer our calls And that's what this bill is set up to do. So I just want to say thank you guys. And thank you for having me, and thank you for the work you're doing. It's groundbreaking, and this is a revolutionary bill. So thank you for joining Miles' name.
Thank you. You know, I think it is this. I mean, I wouldn't be leading this effort had it not been for your advocacy. And so I think it's so important. And to your point, it happens everywhere. There isn't actually. Every time I sat down and talked to one of my colleagues about this bill, even staff that work in the building, everybody had a story of a moment when this would have been game-changing for them. And that's why changing the way we do mental health in California is so critical. And AB 988, which is the Miles Hall Lifeline and Suicide Prevention Act, is the first step in that. And the work the county is doing is such an important step in that, because none of us can do it alone. And I think, you know, Ton's tragic experience just highlights the tragedies that can happen when we don't deal with mental health as a healthcare problem, right? As Ton said, and I remember the first time I really heard her story, what struck me so deeply was how hard she'd been working to get her son help, and how we, as a government, were not there to provide her with the help that, like she said, you know, brilliant woman who was fighting for her son, and he still wasn't getting what he needed, right? And so where are we as the providers of these services to be there for mothers when they need this for their child? And so AB 988, which was the solution that we really came to, that we wanted to move in Miles' name, is coming out of federal legislation, which I will tell you, the most shocking piece about this is that the federal legislation that enables, the federal government controls the phone lines. So they had to enable us to create this system, which they did in federal legislation that passed unanimously in Washington. I didn't even know that happened anymore, but yes, it happens. And this was the circumstances under which it could happen, and it was signed by former President Donald Trump. So, you know, AOC Mitch McConnell and Donald Trump got together and passed this law enabling us to do AB 988. And that hotline that they set up will go live in July of 2022. So in July of 2022, no matter what happens, you will be able to pick up your phone and call 988, and you will be directed to the suicide prevention line. And what we are trying to do in California is go way beyond that, is to ensure that you have more than a person on the end of the line who can talk you through, which is critical. But what Ton needed, and what so many people needed, what Angelo Quinto's family needed in Antioch, was more than what the suicide prevention line can handle. And so what 988 envisions is a system that you call this number, and instead of getting a police response, which is what you get now if you call 911, because that's the only folks we have to respond in most cases, although the county's trying to change that, you will get a mobile crisis response team with trained mental health professionals to respond to you, who are trained to understand the crisis that an individual in a mental health crisis is having. And if police involvement is necessary, they can accompany those individuals or respond if necessary, but that when someone is in a mental health crisis, you will get a separate system with a separate response that is truly a healthcare response by trained professionals. And that, I think, is, bottom line, what Californians deserve. Why is it that when you call and you have a mental health crisis, which is a healthcare crisis, you get law enforcement and you're criminalized for being ill, right? I mean, that is our current system. And so this, I think, is a huge step in racial justice, in changing our healthcare system, and in acknowledging that mental health deserves healthcare, right? And something that I know is changing, and it's changing at the local level, and as we as a state need to be here to support that change, and that's what this bill really does, is support what the counties, especially here in Contra Costa, are already trying to do. And, you know, I get a lot of questions about sort of, what will this look like and what will it change? Well, 10% of calls already that go to 911 are mental health related, right? So a significant percentage of the people who are calling 911 needing support are doing so because someone is in mental health crisis. And so what we want is for those people to have a different avenue in. One of the critical parts of the 988 legislation is that if you call 911 not knowing about 988, you will be transferred to the 988 system, so that everybody who has a mental health crisis will be sent into the mental health crisis response system instead of into what is currently set up as a law enforcement system. What is critical is that sadly, Ton's story is not unique. So 25% of all officer-involved shootings are people in mental health crisis, right? So when an officer shows up to someone in mental health crisis, we're not in a good situation, right? And so if we can stop that dynamic, if we can say, someone's in mental health crisis, it's not going to be a law enforcement response, it's going to be a healthcare response. That's 25% of our officer-involved shootings. That is game-changing. Someone in mental illness is 16 times more likely to be killed by law enforcement than someone who is not suffering from mental health crisis. So this is really getting at the heart of how we change the dynamic of officer-involved shootings on our streets. And I will say that law enforcement is not opposed to this bill. Certain sheriffs have already actually come on support of this bill. My colleague, Assemblymember Lackey, who's a former law enforcement officer of 30 years, is a co-author on the bill. Because they are not, as Ton talked about, they're not trained to respond to those in mental health crisis. They don't want to respond to those in mental health crisis. They want to protect our public safety. And this will actually free them up to do that job that we want them to do and allow the healthcare professionals to do the job that they are trained and we want them to do, which is really critical. Police officers spend 21% of their time and 10% of their budgets on mental health crisis response. So imagine taking that away from law enforcement will be game-changing in creating funding, right, and other things for this response and ensuring we have public safety response. One of the things that you hear, and luckily not where we live, but in certain parts of California, is that police are overwhelmed. They can't respond as quickly as they need in circumstances where they truly are needed. So we take away this part of their job that they don't need to be doing, it will free them up to respond when they truly are needed, which is critical. This has been piloted here in California, but also in Dallas, Texas. They're leading the way, which I know I often get a little surprised faces about that, but they are. And they have, in 1 year, they have diverted 900 people from the emergency rooms through this mental health crisis response system and 500 people from jail. So it's decreasing their incarceration rates and increasing the quality of care that people are getting, which is phenomenal. In Seattle, or in Eugene, Oregon, they have saved millions of dollars in the first year of this program. I mean, this is game-changing both fiscally, but also for the outcomes of those individuals in our community who are suffering. Because someone who's suffering in mental health crisis, as Ton said, isn't a criminal. They don't deserve to be in jail, right? And so if those people, if 500 people would have gone to jail that can now get actual meaningful care, that is amazing. So that's just a little bit about what the bill does, but I'm so passionate about this because I think that it is, when I talk about those statistics, this is significant. There are a significant number of people whose lives will be changed by this legislation, and it's why we're fighting as hard as we possibly can to make sure that it is signed into law this year.
Thank you so much. I'd like to go a little bit deeper into, you talked a little bit about how it works, but I wondered if you could just really take us through what you envision happening, what the bill envisions happening when we call 988.
Yeah, so when you call 988, one of the important things that happens is that the person answering the phone will be trained to handle a mental health crisis, right? So when someone is in crisis and they need someone trained, right? When you call 911 and someone is having a heart attack, they know how to handle that, right? Or they know how to handle a police response. This person will know how to handle someone who's in mental health crisis, which is really critical. So there's significant training for the people at the call centers that will directly answer these calls. And then folks at the call center some people will be able to get the care they need just by the person on the phone supporting them through whatever is happening. But some people may need a response at their home. There may be some reason why they need individuals to show up and help them. And in that case, the counties will send out mental health crisis response teams who can be there to support. The data shows that will only be a fraction of the calls, actually, that the majority of them will be able to be handled by the call centers, and then some calls will require that on-the-ground mental health crisis response teams, and they will be there 24/7 to call, chat, or text on the phone lines and deploy those crisis teams. And then the crisis teams will also have the ability to stabilize individuals. So the bill imagines a complete continuum of care. So the call centers, the mobile crisis response teams, and then crisis stabilization, so that people are getting the services they need really in an entire mental health response system outside, again, of the law enforcement system. But we are setting it up through the Office of Emergency Services, who runs 911, so that these will be interoperable systems. So again, if you call 911, you can get to 988 and vice versa. If you call 988, you needed 911, they can transfer you the other way. And it will allow on the back end for them to manage if for some reason there is a threat to individuals that requires police to also be there, that they can coordinate that as well. So our goal is to have a seamless experience for the caller. You will just be on that phone with that one person, which is actually what happens in 911. There's something happening behind the scenes that none of you know about that gets the fire truck to you. But you have a seamless experience, but they're getting you the team on the ground you need if you need it.
So could you say a little bit more about what the crisis team consists of?
So it's trained mental health professionals who are skilled in de-escalating crisis.
Yeah.
And who can actually show up and do that. So, when Tan's son was in crisis and she needed someone to help her because she's not a trained mental health professional, these people would be able to do that, to assess the mental health needs and respond to it. And then they're trained to also be connected to the community response system behind it. So does this person need a bed to get further mental health care or stabilization services, and then they'll be able to triage them in. But that piece of it, and I really do want to highlight this, of the crisis response is really going to be done by the counties, because they are the folks who do this every day for us and are providing this. So we are setting up as a state the phone system to make sure you have access into those crisis response teams and the crisis stabilization services, and the funding mechanism to help the counties do this incredibly important work and build up more of it, because we do believe that with this system, so this is, as I said, this was a federal initiative, it will go into effect, and the federal government is going to do a huge PR campaign like they did when 911 went live, and we do anticipate a 30% increase in calls as a result of that campaign, because people will now know resources are there, so they will call to get them.
Mm-hmm. You mentioned earlier that this issue disproportionately affects people of color and the homeless population. Could you say a few words about how this system would change that?
Yes, so one of the things we're working really hard, and I want to give a huge shout out to the Kennedy Forum, who is actually the architects of the federal legislation, and the Steinberg Center, both of whom are incredible mental health advocates in Sacramento, who are working with us, have really helped us ensure is that we are going to have cultural competency, which is something the counties do an incredible job of. So be it language competency that you can call, and if you don't speak English, they're going to be able to serve you, but also training to ensure that we are meeting people where they're at. And I think that's really, really critical, because we're going to be serving quite a broad number of people, right? Is this someone who's got a substance abuse disorder? Is this someone who is experiencing homelessness? And each of those folks need a person who is trained to meet them where they're at and coordinate the services that they need. And so we're ensuring that all of that is available. We have part of the bill focused on veterans, right? Where do we meet veterans in the crisis if they are having a crisis? There's special consideration given to tribal governments, ensuring that where we have issues with Native American communities, that we're meeting them where they're at. So it really is about setting up for this incredibly large state of 40 million people, diverse set of services to meet every Californian where they're at.
Thank you. So you mentioned that the hope is the system will go online a year from now in July of 2022. Could you talk a little bit about the funding for this project?
Yeah, this isn't free, and I'm sure all of you are guessing from what I'm saying, but luckily the federal government in the enacting legislation gave us the ability to set up a funding mechanism that mirrors that of 911. So on your phone bills, each of you pays a 911 fee, and that fee covers our 911 infrastructure. And the federal legislation enabled us to do the same thing for 988, so to place a fee on phone bills to cover this entire system, including those mobile crisis response teams and the stabilization services, so that we ensure that as we set this up, we are funding the counties to do that work that we so desperately want them to do, and that some counties are already doing, but also that we are able to build this infrastructure. The good news is, because of the way we're setting up the bill through the Office of Emergency Services, and we passed a few years legislation that funded Next Gen 911 to allow for texting of 911, it's coming to a phone near you soon, we will be able to piggyback on all that work that the Office of Emergency Services is already doing. So the infrastructure will not be duplicated, but will just be expanded to allow for 988 services as well. But also the call centers, right? We're going to need to build up these call centers to deal with the call volume. So all of those costs will be put into this 988 fee that will be on cell phones, although we don't anticipate that it will be, we believe it will be less than or the same as the 911 fee, so hopefully not much of a burden on individuals' phone bills. Although I will say that we are ensuring that those that are Lifeline customers and can't afford it won't be paying that fee, so we're not burdening low-income Californians.
So how will the dispatcher discern if the 988 call legitimately involves a mental health emergency? Because there has been some concern expressed that there would be advantage taken of the system.
So as I mentioned earlier, there's going to be crisis assessment training. And actually, one of the counties that is furthest along in this in California is Los Angeles. They are pretty far along in creating this system, and we've been able to work hand in hand with them to understand how they do their assessments, how it's working, which obviously evolves as they're doing it. But the beauty of this is that it is actually, before 988 goes live, counties are starting to do this work. So we're able to learn from them how to create assessments that will function well, that will ensure that those that need 988 services are getting it, that nobody's taking advantage of it, and that when 911 services are needed, they know to also either bring in those individuals or transfer the individual to 911.
And what kind of support will mental health care workers receive if they need to respond to a 988 call with physical presence?
So the bill specifies that it has to be trained mental health professionals, and some of that will be peers who are trained, licensed social workers. There'll be a broad array of trained professionals who are able to respond, but they will be working closely with local agencies to make sure that they have the support they need. Again, if they need support from an ambulance service, right? If there's some reason someone has a physical ailment, they will be able to coordinate that and ensure everyone is getting the care they need. But there is significant training that will go into the individuals responding so that they are adequately prepared.
Great. You mentioned that there was a unanimous bipartisan 70-0 vote in the Assembly. So where does the bill stand now?
So we are sitting in Senate rules, so passed off the Assembly floor, and now we have to go through the state Senate to get it passed. And we are waiting to be referred out by Senate rules, which we believe we're going to be sent to the Judiciary Committee and the Health Committee. We were actually heard by Communications and Conveyance and Health on the Assembly side, but it appears we may get different assignments on the Senate side. And but we're building up support in the Senate. We think this is really important. We have incredible champions in Senator Eggman, who is the senator from Stockton, who is a former social worker. She's a licensed social worker, as well as Senator Wiener, who has been working on this in San Francisco for many years. So we have champions over in the Senate that we're going to work with, and incredible bipartisan support and co-authorship. So many Republicans and Democrats in the Senate have already signed on to support the bill. So we're full steam ahead in the Senate to get the 2/3 vote it will require to pass this legislation. But we know that it's what Californians want. As I said, it was unanimously supported in Congress, which I, again, am surprised by every time I say it. But I think that speaks to what Americans and Californians want. They want us to be providing this level of care for the community, and so we've got to do it.
Great. So how can so many of us who are here and who are watching, streaming this, who care about this issue, how can we best support the passing of this legislation?
So if you go to the Miles Hall Foundation Twitter, they have a petition you can sign, which is very helpful. So that's one way to follow along. They're always giving updates on what's going on. But speak out, and I'll let Ton answer this as well, but we really need your voices. I mean, as I said, this is a 2/3 vote, which is never easy to get, although we have bipartisan support, and we're confident we'll get it. Most of my colleagues, I actually had a colleague, the Jewish caucus made this a priority bill, and one of my colleagues, Marin, said, well, I didn't vote to make it a priority bill because isn't this a no-brainer? I said, well, I wish everybody felt that way. But we have had people who paused because of the fee, which I understand. Although, again, I mean, look, I don't vote for every fee in the legislature by any stretch of the imagination. There are a lot of taxes I don't support that my colleagues want to move forward. But I do believe that when we have a fee that, first of all, we are baking into it really strong oversight and responsibility, ensuring it can only be used on the things I've mentioned, that it can't be diverted for other purposes, and that it is going to provide such a critical service that's when we do it, right? When we get a good return on that fee, then it makes sense to do it. And, as far as I'm concerned, 30 cents is well worth this kind of service. And so again, not for low-income Californians, but for all of us, there's no question that I'm willing to pay that to ensure that those suffering can get the care they need. So, do you have anything to add on how people can help?
Yeah, I mean, absolutely. So I would also go to justiceformileshall.org. We have a whole website that has AB 988, the Miles Hall Lifeline Act, as a tab. So we keep that updated, and also Facebook and Twitter and Instagram with the Justice for Miles Hall. So there, I mean, we keep up on it. So we let people know like how they can help. Like if when they go to the different committees that people need to sign in, and we push that out. So I would definitely go to our website, and also, like I said, Facebook and Instagram and Twitter. So yeah.
Thank you. There's been some pieces written about how law enforcement stands on this issue, and I wonder if you could address that.
Yeah, there was my parents are both Texans. They grew up in Dallas, and most of my family is still in Texas. There was an article in Texas about how I'm, taking law enforcement's job away. And that was an interesting take on the bill because, like I said, law enforcement has been our partner in having this conversation. The LA County Sheriff, who has been working side by side with the county supervisors down there to set up this model, is one of the a close advisor of ours to make sure we understand that we're doing this in a way that is safe. What we want is for everyone to be safe. Miles Hall wasn't safe because he wasn't getting the care he needed, right? And if what you need is a police response, we want you to be safe too. And so we're working very closely to craft the language such that we ensure that folks get the response they need, be it a dual response or an individual response from either the crisis response teams or law enforcement, but that we're providing safety and security for all of our community members, including those that are in mental health crisis. And so, like I said, Assemblymember Lackey stood up on the floor. He's a law enforcement officer of 30 years and spoke about the importance of this bill and the times that he showed up to an incident and someone was in a mental health crisis and he was unprepared. He wasn't trained to deal with it, and he wants someone who's trained because he knows that community member is going to be safer if someone who is trained responds. And that's what he cares deeply about, is the safety of our communities. And that's why law enforcement has really been our partners in this, and I believe will continue to be.
Great. Thank you. Thank you for taking us through the details. I wonder now if we could just step back and ask a few broader questions, if that's okay. I wondered if you could talk a little bit about how your Jewish faith has inspired you to pursue a career in public service.
Well, before I answer that, if anyone has any questions, too, we do have question cards.
Yes.
So you can raise your hand, and Matthew will bring you a question card. My Jewish faith. So that's a great question. You mentioned actually at the beginning about my family history, my grandparents coming here as Holocaust survivors. And, I was raised by survivors, right? I was raised to understand that this country literally saved my family's life, right? My family got out of Austria and they were living in Vienna. They got out in 1939. And one of my great-grandfathers was in Dachau, but luckily got out and came here. It's a story that many people in this congregation share with me, but my upbringing was like, okay, you owe this country everything because you wouldn't be here without it. And that's what, I'm one of 4 siblings, and all of us are in caring professions. 2 are rabbis. And, I think that upbringing led me to where I am today, to know that I wanted to make this country the place that gave me the opportunities that I have and make sure that everybody has that opportunity to survive and to thrive. And, every year I get to decide what my bill package looks like and what bills and legislation we will move forward on behalf of this community. And it really is the conversations that I get to have with every one of you, right? I carried a bill partnering with a family here in Danville a couple of years ago that had lost a daughter to a nut allergy, on training restaurant workers to ensure they understood that allergy so they didn't accidentally expose folks who would die to nut allergies. And, so it really is the partnerships with this community that lead me to where I am. And, But I think at the heart of all of that is tikkun olam, right? Is repairing the world. Like what we are doing through AB 998 is repairing the world. We are making it more whole and safe, and that is the work that each of us tries to do every day. And I just happen to be privileged enough to have each of you elect me to do that in this capacity. And I will do that for as long as you give me that honor, because it is such a gift.
Thank you. Thank you. So we in the Jewish community and in our broader interfaith community, we work so hard on social justice issues, and we're always wanting to know how we can better support our legislators around these critical issues of social justice and racial equity.
I mean, I think it is be in relationship with us. I think, so, you know, we get my incredible staff, who I should give a huge shout out to. I think all of my district staff is here. They spend all day, every day, hearing from constituents about what it is you all want me to do and work on. And I think that is such critical work. And often I meet with groups from congregations about bills that they care deeply about and want me to move forward. I actually just scheduled a meeting with Camp Newman campers. They want to talk to me about a criminal justice issue that will be before my Public Safety Committee. And I think that is so important, because it is hearing from you that makes me a better public servant. I mean, that's very clear. So don't be shy. We have, my staff's favorite way for you to communicate is the web form that's online and comes directly to me. And actually, this is a fun fact. So we have iPads in the Capitol, and that's how I read all the bills and the analysis of the bills. And there's a tab on my iPad that says constituents. And when I click on it, I can see every single constituent with their name that has called me on that bill and whether they're for or against. So at my fingertips is what each and every one of you thinks if you tell me, for every single bill. And we vote on a lot of bills. But no matter how you contact us, phone, email, web form, you are there telling me what you want me to do on behalf of this community. So please be in conversation with us in whatever form that is. And then that means both legislation that's pending, having this conversation about legislation that's pending, but also things you want changed, right? People come to me and they say, I think this is broken and I want you to work on it. And it can range from that you can't, I had a meeting recently about people who were frustrated they couldn't recycle their cans anymore at the grocery store, or they want, mental health crisis response changed, right? So it's an array of things that people come to me and discuss, but your voices matter and we listen.
So in addition to this vital legislation, what other police and criminal justice reform efforts should we know about that are being handled by the legislature right now?
Yeah, so we're doing a lot, as we do in California, and it's all very important work. So, just a few years ago, we passed AB 392, which was the strongest use of force bill in the nation. It still remains the strongest use of force bill in the nation. And I'm hearing from law enforcement who we were able to really work in partnership with the advocates and law enforcement to come up with a bill that was workable, and law enforcement says it's changing them. And that's what we want to hear, right? So it is, that's not an overnight process, but we want change to happen through the legislation that we move. And there's big bills, right? AB 98 is a huge bill in changing the way we deal with the criminal justice system and who's involved in it. We have a bill pending before the committee related to decertification of officers who have committed a crime or otherwise done something that maybe means they shouldn't be carrying a gun and wearing that badge anymore. And then we have bills that are really meaningful that are smaller. I have a bill this year that is, I'll confess to you, one of my favorites. I'm not supposed to have favorites. It's like my children, but I do. That currently a juvenile who is transferred into adult court after being accused of a crime, which is a huge,
You're good.
Is it on? Okay.
Yeah.
So the juveniles who are transferred to adult court, and this is a decision that will change their lives, right? If you're transferred from juvenile court, which is a rehabilitative system, to adult court, you end up in CDCR with adult criminals. You are given an adult sentence, and for some folks that may be justified, but there's no right to appeal that decision right now. So a single judge makes that decision, and there's no meaningful right to an appeal for those juveniles, and this is a life-changing decision. And so I'm carrying a bill that will give an immediate, urgent appeal to juveniles of that decision, and it will be up to the judge to uphold it or overturn it, but we believe that appeals are an important part of our justice system. That decision
changes people's lives. And so it's about 100 youth a year that are transferred from juvenile jail to adult court. So in the scheme of 40 million people, 100 people, but for those 100 kids, this is game changing, right? So we have bills that affect less people but are game changing, and then bills that really will change. I mean, 25% of all officer involved shootings. This bill, AB 988, will change a lot of lives.
Thank you. Thank you. So now I'd like to see if we can field some questions from our gathering here, and as well as questions that, thank you so much, questions that were written into the chat by people participating tonight virtually on the various platforms that are available. We have more. Thank you. Thank you. Great. We have a question here from someone on Zoom. How will 988 mesh with existing programs at the county level, and what can we do to increase citizens' oversight in regards to police use of force?
Oh, that second question is a hard one. We'll start with the first one. So
Okay.
it will mesh. I mean, it will be like, it will mirror similar to what you experience with 911, right? So you call 911, which is a national number, and you get your local police to show up, or your fire department here in the San Ramon Valley, right? So 988 will be similar, right? You will call in, there will be a handful of call centers throughout the state, but it will be the county on the back end providing the mental health crisis response and stabilization services. And it will feel seamless to you, but it will be working hand in hand with the counties. So they have been an incredible partner. Like I said, Contra Costa is the sponsor of the bill. They've been involved in conversations. The county behavioral health directors we talk to them maybe twice a week about this bill because we know they're so critical in making this work. And so they really are working hand in hand, the county and what the state is setting up. And part of, to be honest with you, one of the reasons this bill is so urgent is that many counties are moving ahead, like Contra Costa is, to do this. And if we don't tell the counties where the state is going, we're afraid the counties are going to go ahead and do this in ways that doesn't work with the state infrastructure. And we want it to really be seamless and work. And the last thing we want to do is waste resources by having counties set this up and then 2 years down the line for us to come along and say, no, no, you need to do it this way, and have to recreate the entire system. And then how can citizens get involved in police oversight? Do you want to speak as a citizen?
I mean, I think as far as for our constituents to get involved is to, I guess, speak to you, speak to your legislature. I mean, just have a voice and show up, right? Show it up to your city council, show up to the board of supervisors. I think that's partly why our group has been so successful, is we're just not going away. So that's it.
Great. Thank you. We have a question from someone here that says, will 988 interface with 211?
So not directly. So if you call 211, the systems will not be able to communicate the way 911 and 988 will, because those will be both run by the Office of Emergency Services. And someone actually asked me why not just use 211? And 211 will still serve a really important function. Not everyone is in immediate crisis, right? So I'm in immediate crisis. Today I would call 911. Right? But that's not the response I should get. But 211 will still be there to support you in your ongoing needs with the county. So they won't interface, but they will still remain very, very critical.
Thank you. We have a question here. Can someone with private insurance or no insurance access these county behavioral services?
Yes. So we are requiring, because we're always paying attention to that fee and making sure it is as low as possible, that the counties do have to seek reimbursement. And last year we passed a bill requiring private insurers to cover some of these services. So the counties will be seeking reimbursement from those who are insured or who are Medi-Cal covered. But anybody can get these services, whether they are insured or not. And then if they are covered, it will get reimbursed. I will add, though, a fun fiscal fact about this bill. I just said fun fiscal fact. It's not something you hear a lot. But the federal government in their legislation agreed to cover 85% of the mobile crisis response teams. So the fee will only have to cover 15% of that, and the federal government will actually be covering the vast majority of it. So part of why this is so critical is that if we can put up that 15%, we'll get the 85% match from the federal government.
Wow.
That was a fun fiscal fact, wasn't it?
It was, definitely. So, someone here has asked, I understand many edits were made to the text of the bill before it passed. Would you like to discuss the process of how we can get it to include more than just a suicide line?
Yes, so now you're talking about how bills become a law, and that old cartoon doesn't really cover it, in case you're wondering. So yes, so the bill has been through a process. We had introduced legislation that was pretty comprehensive in providing for the funding mechanism, the structure, how this would work with OES and 911 and the law enforcement role, et cetera. We had taken amendments in the health committee to working with the behavioral health director to ensure that we were moving it forward. We had then taken additional amendments to cap the fee to ensure that it only covered actual costs, to make sure that we were making it as tight as possible, as I said, so this wouldn't get, these costs would not get, the funds would not get misdirected. And then we got to Assembly Appropriations, and there was a huge change in the bill, and it was changed so that we could really take a fresh look at how we structured it. One of the things we had done initially was give the entire 988 system to the Office of Emergency Services. Well, one of the immediate feedback we got, which is right, is that the Office of Emergency Services, which as a Californian, I think 911 works beautifully, right? We're going to 911 Next Gen, but they are experts in the 911 system. And so we wanted them to host it, but they were also in charge of the mental health response. And OES is not a mental health organization. And so they wanted Health and Human Services to be involved because they're the mental health experts. And so one of the things we are really working on right now is how do we structure this so that the right agencies hold the right piece of this to ensure Californians are getting the care they deserve and that we don't have the wrong agencies owning the wrong part of this. And so as a result, what moved off the assembly floor was pretty bare bones. And then Monday, we are going to put a new structure into place that will have more complex system of how it will work at the state level, which was a very complicated answer. But and then we will move that bill through the Senate. So we continue to work on it. This is really complicated, right? It may sound simple, but how this all works in the state and who owns what portion of it and how you make sure that we're coordinating with the counties to make sure that each of them is functioning with as many counties as California has, and such diverse counties, right? LA, which having a mobile crisis response team really close to you probably isn't very complicated. Then you go up to Shasta, and well, having a mental health crisis response team that's really close to you is much more complicated, right? So we have a really diverse state. So we're working to ensure that we're able to provide services to every Californian, whether you live in rural California or urban California.
Thank you. So someone has a question for Todd from Zoom. Can you share more about the Contra Costa Miles Hall Crisis Response Program and the work done to develop that?
So yeah, so the Miles Hall Crisis Hub was basically and created. It's a non-police response, right? So, but the Crisis Hub is where all the services are going to go. So like. It's going to almost be like the call centers and like where things are like distributed from there. So it's I can't give a full answer about that, but you want to speak?
Sure, please.
Here we go. I'm not on all the design calls every week, so.
Just really quickly, I'm not going to go through the
Why
whole
don't you
program.
Step in the center. We want you to be seen.
Okay, take off my mask. I'm not going to go through the whole program,
what,
but I
Gail?
wanted people.
Sit right here
Oh
so
my
you could be
goodness.
seen.
Okay, Dan. I wanted people to know that there is a video on YouTube that's available at Contra Costa Health Services that outlines the county's program. So Contra Costa Health Services started working on the community crisis mental health response back in November of last year. And they put together some value mapping, and then we have had 3 rapid response report outs where they go through the potential program that they're going to do and find how to improve it. And they've looked at the different type of software programs that will be used for the hub and for referring, etc. And it's all laid out in about a 50-minute video on YouTube that's very interesting, and it explains how the hub's going to work, and referral to 211. That's going to be one of the places people who call 988 will get referred to 211. So there was a question about that as well. So anyway, go to cchealth.org. I actually have on my phone the link, and if I was on Zoom, I could put it in the chat. But oh, okay, great, and then they could stick it in there. All right, I will do that. So anyway, it's a lot of the cities were involved in the program, and there's different police departments that helped put this whole thing together. And within the next couple weeks, the county's going to be doing a pilot program for this community crisis response. So anyway, just wanted to update everybody on that.
Thank you, Gail. Thank you so much.
I will say I've seen those report outs, and they're actually really fascinating. You can watch them online. So they're super informative if anyone is interested in that.
We have another question. Would someone need to meet the 5150 criteria to access the service? Why don't you explain what that means?
No. So 5150 is an involuntary hold.
Yes.
And that is a level. You have to meet that level in order to be held. But this is, I mean, I was talking to someone, and she said, my neighbor, my neighbor was struggling with mental illness, and she would have these episodes, and well, could I have called 988? And yes, right? I mean, you can call 988 anytime you need help with mental health crisis, right? So that can mean anything. And those people will get the services they need. And again, some of those people may just need the phone operator who's trained to walk them through what to do and then be referred to 211. Or they may need someone to show up because the person is acting in a way that feels not right to them and they don't know what to do, and then they'll get the mental health crisis response team. And so there's no standard by which someone needs to meet to call 988. You will hopefully call 988 if you think you need it. We actually were just interviewing an amazing student who works here in the Tri-Valley, in San Ramon Valley, on teen suicide prevention and trainings she does. And she was telling me a story in our conversation about how she had a friend who mentioned suicidal ideation. And she said, I didn't know what to do, right? And luckily, I knew there was a suicide prevention line, and she called it, right? And she got the information she needed. So that, that individual can call 988 to get the advice they need. It really is there to be a resource for anyone who is in mental health crisis or is with someone in mental health crisis, with no standards that would require an involuntary hold.
Great, great. We have one last question. Do you feel that there is an intersection between this legislation and the gun violence prevention movement?
Yes, and I'm a Moms Demand Action member, and we have some Moms Demand Action members here in person, and they are actually hugely supportive of this bill, and they've been incredible. They call into my hearings. It makes me real happy. Yes, I mean, what gun violence prevention means, preventing gun violence, gun deaths, and gun violence. And as you heard from Ton, those officers who show up and are not trained, and then gun violence results because mental health crisis is the issue, if we can stop that, we are preventing 25% of officer-involved shootings. So that is a huge part of that piece of gun violence. Now, there's a lot more to work on, but it's a piece of it, and we need to work at every piece. And so I think it's really critical in preventing gun violence, and it is absolutely a piece of the gun violence that Californians are experiencing right now.
Great, great. Wonderful. Well, I want to thank everyone who's here and everyone who's joined us virtually tonight. I want to thank Ton for being with us. Thank you so much. And the Interfaith Council, all of the supporters who've made this possible. And hopefully together we can pass this legislation and reform our system and save lives. And thank you, Assemblyperson, for being with us tonight. And thank you. Thank you.
Well, I want to say my thank yous before we close. So I want to thank the rabbi and the congregation for hosting this, for putting this together, and for helping spread the word about this important work, because it really does take, for this level of impactful legislation, it takes a lot of work and a lot of community members advocating. And as a result of this work, we've had almost every city in my district write in support. Right? We've had the county write in support of this legislation, showing, the broad support that this community has for this type of legislation, and that is so, so critical. And I want to thank the Interfaith Council for being our partners in this. I do think you asked the question about my Judaism, but it is, faith is such a huge part of what drives me forward, and to be in conversation with folks who share that is really special. I want to thank Tawn again for her bravery. It's not easy to do what she's doing tonight, as all of you know, but she harnesses the strength and she uses it to make a difference. And as we know, in our Jewish faith, saving one life is such a mitzvah, and I think that Tawn will save a lot more than one life through the work that she is doing, and that is so incredible. So thank you for being here. Thank you for your bravery. I know I've said this before, but Miles would be so incredibly proud of you and the work you do. And I want to thank my team, some of whom are on Zoom because they are in the Capitol, and the team that is here today. They are my partners every day in this work, and I couldn't do any of it without them. So they are just incredible, and I know together we are hopefully representing each and every one of you and doing this community proud, because that is what we wake up every morning and try to do. So thank you to all of them as well. But we work hard on this legislation. It is the thing we spend the most time on right now at the Capitol, but it is worth it every day, because I know, again, that what is driving me is the values of this community. And what this community cares about is people, and is doing right by people. And it's why I'm raising my family here, and it's why I love representing each and every one of you. And this bill is going to change people's lives. And so thank you for being in conversation with us about it and for being supportive of it. And we will keep you posted.
Thank you so much.